I would like to say I am aware of how ghetto this is, and it's whatever. The whole point of this is for me to show you guys a concept. Like, y'all are going to come after me, and you know what? Bring it on, because this is my understanding of kind of how breast cancer works. I'm not a doctor. I am a nobody. So, like, take it as you will. Like, just bear with me. I hope my whole goal is for people to be like, oh, okay, I see why cancer is so complicated and why everything just doesn't make sense. So, I'm going to talk about 3 receptors on a breast cell. Normally, we all have these receptors, men and women, on their breast cells, because men also have breast cells. There are 2 that are hormone receptor cells, estrogen and progesterone. And then we have human epidermal growth factor receptor, which is known as HER2. And I am HER2 positive, estrogen and progesterone negative, also known as hormone receptor negative. So my cancer did not come from hormones. It came from HER2. This is me just clarifying that there are 2 hormone receptor cells. They go by HR, which can be a little bit confusing because HER2 is HER, but hormone receptors is abbreviated HR for people that are either hormone receptor positive or hormone receptor negative. Or it might be abbreviated as like ER and PR, which is progesterone receptor and estrogen receptor. So I think there can sometimes be a little bit of overlap of confusion. But basically, there's receptors on a cell. And when you have estrogen and progesterone on the cell that's causing cancer, it could be like an overproduction. Honestly, I don't really know exactly all of the ways of why cancer, like, I don't know what the malformities are, but it's specific to those receptors. So you can have estrogen and progesterone positive breast cancer and be HER2 negative, which is what I was trying to show there. And then you can also be hormone receptor negative and HER2 positive, which is my type of cancer. And then you can also be triple negative, which is the hardest to treat. And there's not a lot of research out for it. So triple negative is a very scary breast cancer to have. They all are. I mean, it depends on the stages, right? But it's very scary because it's much harder to treat. When you have the receptors on the cell, you can treat those receptors. But there's also a whole bunch of other factors that go into it. So depending on how your cancer is formed, if you have it like a whole bunch of receptors, I used HER2 positive, taking over the cell, and that's why it's a cancer cell. And then you have treatment that comes in and attaches to the receptor. And then I just realized I should have put the fucking microphone in and I didn't. Gosh damn it. All right. Well, maybe this will be better. I don't know. It's targeted therapy. So it targets the HER2 receptor, or I guess it's redundant, the HER, the HE receptor. And so it targets that cancer, but eventually, I just yawned, I'm so sorry, I'm so tired. The cancer cell gets smart and it gets a brain, and then that's in the middle there, which ignore me drawing other treatment options, but treatment 1, treatment 2, treatment 3. So this brain is how smart the cancer is. And then it either, you can see it looks like a sunflower at the bottom. And so then it's just like amplified, like the cells going crazy, right? And so when you're on treatment, you're likely on the highest dose or on the highest dose that you can tolerate. And so what that means is, for example, I'm on a trial, I'm on the highest dose, but there are a lot of people that can't be on the highest dose, either because they have terrible side effects like diarrhea, mouth sores, vomiting, just feeling bad the entire time, heart toxicity, liver toxicity. And so you end up needing to go on a lower dose. And then if you are on the lower dose and the treatment the cancer changes and the treatment can't sustain or maintain the cancer, then you have to change treatment. Or if, somehow the cancer adapted and the treatment's not working, then you have to change treatment. And that's kind of how things go. It can get really tricky because then maybe the second treatment isn't your recipe for whatever reasons, because you can't tolerate it, or because it's not slowing down your cancer or stopping your cancer. There's a lot of reasons why it might not work, but having like heart toxicity and liver toxicity are like serious things. If you have heart toxicity and you're on treatment, well, then your heart is eventually going to fail. So they have to take you off the treatment because your heart is going to make you die. And the whole point of it is to have a better quality of life. When you have advanced cancer, your quality of life matters. So if you're having heart problems, but you're living longer, it's about having a better quality of life so you can enjoy your days. Another cool thing about the top there, I had wrote Herceptin. I just wanted to talk about that really quick. HER is for HER2 because Herceptin is a drug that intercepts HER2. So it was made, I think, in the year like 2001 or something like that, and it won a Nobel Prize. It changed the game for breast cancer, HER2, and usually you'll be on it indefinitely, Herceptin and Perjeta. It only worked 6 months for me, but I'm on a different form of it. I'm on it in HER2. And so just to kind of show a different photo of it, there are a lot of ways that you can have breast cancer. You can be estrogen and progesterone negative, positive, HER2 negative, and so it can get really complicated. If you can tell, I wrote out a bunch of different ways of the types of breast cancer you can have. Triple negative is the worst. It doesn't have any receptors, so it's really hard to do targeted therapy with it. But yeah, that's basically it. So again, this was all about a concept, and hopefully I didn't confuse you even worse. But now if you see a cause and it says something about supporting HER2 or triple negative, you kind of know what that's all about. Right now, for all types of breast cancer that are stage 4, meaning they are advanced metastatic, they are incurable. So research and support is very much needed for all stages, but especially when it comes to incurable types, because longevity is limited. Anyway, thanks for watching. Hopefully I didn't just completely confuse the hell out of you.